We're seeing people develop symptoms anywhere between about 24 hours and 72 hours after the exposure to somebody who's positive. However, there are the extremes that could be up to potentially a week. So we're saying up to a week after exposure to a known case is the period during which you should be watchful for symptoms. However, that shouldn't exclude you from doing anything. Only if you have symptoms are you actually infectious to others. And so there's absolutely no reason why you couldn't carry on in a normal manner until such time as you were to develop symptoms, if you were unfortunate enough to. It's possible that you might have the virus and not be aware of it, in that you have such mild symptoms that you don't even notice them. But you really are only infectious for a short period of time before you develop symptoms, a matter of a few hours, or actually when you have the symptoms, when you're sneezing and producing that runny nose, when you are coughing and producing particulates, that's the time you're infectious.
Okay, so if you've been in contact with someone but you're not showing symptoms, then it is okay to proceed.
Absolutely.
But are there any precautions that you should take?
The precautions that everybody should be taking, that I'm sure everybody's aware of and are everywhere now, that if you're sneezing or coughing, whatever it is, cover your hands, cover your nose and your mouth into a tissue in the bin and wash your hands afterwards. And if you do sneeze over the telephone, clean it afterwards. So, if you've got wipes and things available in the office, wipe them down. And similarly with doors and handles, sometimes we do get caught short, if you like. We don't happen to have time to get a tissue from our pocket when we sneeze, so we sneeze into our hand. That's fine, but wash it afterwards and avoid opening the door with your hand. Use the other hand or ask somebody to open it for you. Just simple things that will help stop the spread of swine flu and also stop the spread of any other respiratory or other infection. If you do see symptoms and you have concern, then there's the helpline, which is the 0800 513 513. And if you're convinced that you have swine flu, then you need to phone the pandemic flu line, which is 0800 513 100, which will actually talk you through the symptoms you have, and you'll come to a decision following that whether you actually have swine flu. Alternatively, there is a website which is pandemicflu.direct.gov.uk, which will talk you through the same sort of thing, ultimately giving you a special number so you can collect Tamiflu from one of the antiviral collection points.
If I've been in contact with someone who's had swine flu, but I don't develop the symptoms myself, does this mean perhaps that I'm immune to it?
It's potentially unlikely. What we're seeing with this viral infection is that those over 65 seem to have the smallest proportion who are becoming infected. Now, it could be that, having been around for that little bit longer than the rest of us, they've been exposed each year to a different variety of influenza viruses, that they've acquired some immunity from those viruses, which is protecting them slightly against swine flu. The Tamiflu won't actually stop you necessarily being ill, but what they will do is significantly reduce the duration, by the time you're actually ill, and will reduce the severity of the effects of the virus. And they do that by stopping the virus breaking out of the infected cells. So it doesn't actually kill the virus, it just stops it spreading to more cells and therefore minimises the effect.